Hi, my name is Lisa. I'm the dermal aesthetic therapist for SKINSTORE, and I also do the product recommendations. I did my 4-year training program at Isaac Carton's Academy in Stellenbosch, and I of course love everything skincare related. All of the products mentioned in this video will be available on our website at www.skinstore.co.za. For this video, I will be focusing on dry, sensitive skin and how to improve it, and also how to repair a damaged skin barrier using products from La Roche-Posay Toleriane range. So the main thing that causes the skin to become dry and sensitive is when the barrier of the skin is impaired. So something that then happens is transepidermal water loss, which means that the skin is actively losing water, meaning water evaporates out of the skin, and this leaves the skin dry and tight and dehydrated overall. The pH of the skin also changes when the skin barrier becomes impaired, which can lead to quite a number of inflammatory conditions. There are quite a number of contributing factors when it also comes to dry and sensitive skin. This includes an overall baseline hydration level that is lower, so you already don't retain as much water in your skin, and then of course genetic predisposition. Then of course having a history of a damaged skin barrier that didn't heal properly, so things that could have caused your skin barrier to become damaged is things like acne medication, so whether it's oral or topical, things like overexfoliation, eczema condition. Hormones can also play quite a big role, and then of course just having a generally higher nerve sensitivity to stimuli. A range that never fails when it comes to allergy-prone or very sensitive skin is the Toleriane range from La Roche-Posay. First off is the Toleriane Derma Cleanser from La Roche-Posay, and this is a very high tolerance cleanser for anyone with very sensitive or reactive skin. So if your skin reacted to another cleanser, this one might be the one for you. It can be used on extremely sensitive skin. It can also be used when you have a flare-up. It is a little bit more of a thicker consistency. It does contain La Roche-Posay thermal spring water, and it can also remove makeup. So you can use it on your eyes and on your whole face, neck and chest area. Next up, we have the La Roche-Posay Toleriane Sensitive Rich Cream. So this is quite a thick, rich, deeply nourishing cream. It helps to prevent water loss in the skin, so it helps to prevent the transepidermal water loss, and then of course it helps to soothe sensitive skin. It also supports the skin barrier, and then of course it does not contain any alcohol or fragrance. It can be used both in the morning and evening, or as many times in the day as you need it. So anytime during the day when your skin is feeling a little bit extra dry, or especially in the winter time when our skin does become a little bit more dry or a little bit flaky sometimes, even in a more worst case scenario, this would definitely be the one for you. And then of course it is also suited for babies, so you can use the La Roche-Posay Toleriane Sensitive Rich on your baby if your baby is 3 months and older and has very sensitive skin or dry and dehydrated skin. Lastly, we have the La Roche-Posay Toleriane Derm Allergo Cream. And this one is for ultra sensitive skin. So if you've tried everything else and you have gotten a reaction from it, this one would be for you. It's a soothing, hypoallergenic cream that just helps to calm the skin. It also, of course, does not contain any alcohol or fragrance. It contains ingredients like neurosensine and La Roche-Posay Thermal Spring Water. These obviously help to reduce the inflammation in the skin and help to calm irritated and angry skin. This is also a really great option to add into your skincare routine. This is the La Roche-Posay Hyaluronic B5 Serum. It can help with fine lines on the skin due to dehydration. It obviously also helps to hydrate the skin because it is hyaluronic acid. And by hydrating the skin, it also helps to repair the skin's damaged barrier. And then of course, always remember to check the ingredient list of products before buying it, because you could maybe have an allergy to some of the ingredients, especially if you're using the products for the first time. And also remember that skin conditions can take anywhere from 4 to 6 weeks to improve or to heal. If it is in this case that your barriers may be disrupted, sometimes we have some secondary conditions coming out as well. Like for instance, you may be having some acne due to a disrupted barrier or some eczema due to it. So those secondary conditions also then have to heal or improve. So it can take anywhere from 4 to 6 weeks, and this also depends on what products you are using or what product you are using. It is, of course, always a good idea to go and see your doctor or dermatologist when you are very concerned about a certain skin condition that maybe recently popped up or something that you've had for a very long time. It is always good for a doctor to diagnose it first and tell you what is actually going on before trying to treat it at home or trying to treat it with over-the-counter products. Sometimes we do need medication for certain skin conditions. Remember to also wear your SPF every single day at the end of your skincare routine in the morning. The last step is our SPF. So please do remember to use the SPF of your choice. Make sure that it is a broad spectrum UVA, UVB SPF, preferably an SPF 50, but SPF 30 is also effective. Please comment your favorite product for skin sensitivity or reactive skin down below in the comments.